The STAR approach is a suite of materials that we've developed to help to get better value from healthcare resources. It's all about helping those responsible for commissioning services to work with their local stakeholders, to involve them in that decision making. One of the benefits of STAR is that it enables commissioners to really focus on where their decisions are going to make a big difference in their spending, looking at areas where they feel that spending is high but maybe the benefits aren't as widespread as they would like them to be. So it really provides a focus to where some changes to how resources are spent can really increase the value, reducing costs and spreading benefit much more widely across the population. The STAR approach is the socio-technical allocation of resources, and it's really important that both of those elements, the social and the technical, combine to give us the approach. So the technical is data analysis based on an Excel spreadsheet. It's certainly not like any other Excel spreadsheet that I've ever seen, but the idea is that it's very compatible with whatever systems people have, so there's no need for additional software. So the Excel spreadsheet takes available data, what people can source about the cost of their services, the number of people in the population who will benefit from a particular intervention, and the benefit that individual patients will gain from having that intervention. And through some very complex behind the scenes algorithms, turns that into a language, a visual language of triangles, which you can compare the cost and the value of services by the size and shape of the triangles. And the value of that is, it means that people in a meeting presented with this information can all understand how those services therefore compare to each other. The social side consists of a stakeholder workshop run by an expert facilitator. And it's really important that the facilitator understands how to take a group through all of the different levels that make up the decision that they are seeking to come to a conclusion on, and has ways of ensuring that all of the stakeholders, the commissioners, the people providing the services in the hospital or community services, patients who've experienced those services, and members of the wider community all come together to consider what are they going to give priority for, what's going to give the best value for the resources as they're used within their health economy. The STAR approach is developed from research that the Health Foundation has funded at LSE for a number of years, and the research was looking into the area of value for money and understanding what creates value in healthcare services. We've particularly thought about clinical commissioning groups because they're now just taking over responsibility for commissioning health services in England, but it will also be very useful for people who are planning areas of service provision in hospital trusts or community services, for health boards in the rest of the UK. The original model was tested extensively by LSE as they were developing the theory behind it. Since we've developed the materials, we've tested those in use with live groups, a number of CCGs around the country, looking at different clinical conditions and in different situations. So we've tried it out for real, and people have found it beneficial.